Good morning, everyone. So it is my pleasure to be here with everyone today to acknowledge all of the advocates and organizations represented here today for World Mental Health Day in council chambers. First and foremost, our county executive, Mark Elrich, thank you so much for coming across the street to join us this morning. And we also have members of the National Alliance on Mental Illness of Montgomery County, NAMI, Every Mind, and the Division of Psychological Services with MCPS in attendance. And finally, we have Kimberly Fogg, the founder and chief of mindfulness at Global Sustainable Partnerships. Thank you so much for being here today. Global Sustainable Partnerships is a nonprofit founded in 2010 and during the pandemic. They have prioritized the need for comprehensive mental health care solutions, particularly for our communities of color. This year's World Mental Health Day theme is Mental Health is a Universal Human Right. When I think about this year's theme, I think about all who are hurting and suffering due to their mental conditions, but cannot receive help due to systemic barriers that prevent them from accessing care. Research finds that access to care and treatment for mental health issues remains out of reach for most populations in the United States, even though more than 1/5 of United States adults, that's 21%, 52 million, had a mental illness in 2020. This statistic is such an essential piece of context for us to keep in mind when discussing mental health. Mental health issues can happen to any one of us. No matter our background, upbringing, economic status, we can all do something to help reduce the barriers to care and make it easy for residents to access the critical care we need. Since taking office, I have been working on some critical initiatives to advance mental health care. During the past budget cycle, we provided additional funding for mental health and wellness centers and linkages to learning programs, as well as our minority health programs, which improve access to mental health care for our communities of color. Also on the Health and Human Services Committee, we've been working closely with the Department of Health and Human Services to streamline access to care and map out the abundance of mental health resources that we have throughout Montgomery County. Finally, I want to thank our county government for receiving the Gold Bell Seal Award in July for being a national leader in workplace mental health. Our county is committed to promoting mental health at work, fostering diversity, and most importantly, reducing stigma. Without further ado, I want to turn things over to our county executive, Mark Elrich. Thank you.
Thank you. So this is one of those difficult subjects to talk about. I think we all recognize, not just in this room, but in general, that there's been an increase in the challenges to people's mental health over the last few years. And COVID certainly played a role in it, but there are a lot of other factors at play. In some communities, it's living in generations of poverty and not feeling like there's any way out. In other places, it's just simple, flat out lack of access to health care. I don't know how many people remember, some of you aren't old enough in this room, but some of you are. Montgomery County used to have a system of mental health clinics, and there were multiple community clinics in Montgomery County. They are no more. A previous county executive, not Ike, made the decision to close the clinics in this county, and he closed them and replaced them with nothing. And so a facility and an infrastructure that we once had, we don't have any longer. And we have a lot of important nonprofit partners, but all our nonprofit partners are stretched. And when we, go to try to build teams, for example, to emergency responses with our police, we struggle to find staffing to sit on those teams. And so we know the need is great out there. We know that we have to do more than we're doing now. We're still looking at a model of expanding our ability to house county clinics or create county clinics. We think that would be an important way of providing access to community care across the community. We're looking with partners. We've had conversations with hospitals and with other statewide mental health entities to see if we can find people who would partner with us in trying to expand these projects. I think it's really important to do. We have a lot of youth who are just frightened about the future. You know, it is not good to talk to young people and say, I don't want to bring children into the world. I don't want to have kids. If you're depressed enough that you don't want to have kids and you're a teenager and you don't want to raise them in the world they're growing into, you have a problem out there. And we know that there's work we have to do. Some of it is we have to give people the faith that we actually can tackle the problems we face and do something about them. I think when people feel that they have no control over the future, no control over the situations they live in, it's depressing and it leads to a sense of despair. And I think, you know, we as political people have a responsibility of making pathways forward as clear as possible and to give people a sense of possibility in general about where society is going. But in the meantime, we have to provide the mental health supports. So I'm glad the council has been supportive. We've put money into the schools to bring more support into the schools. We're going to continue to expand our request for resources. We're going to be asking for more people from mental health teams in crisis response, and we're going to be asking for more resources to deal with mental health issues in this county. It's too important to neglect, and it's not going to go away. This is not something that people are just going to grow out of. It's not like, yeah, you're just a teenager, you'll feel better when you get older. Mental health and mental health problems are not something you grow out of. They're things you're helped out of and things that can be adjusted if people are given the opportunity to get the help they need. So that's what I wanted to convey, is that we're committed to doing that. We understand the gravity of the problem and we intend to be part of the solution. So thank you, and thank all these amazing nonprofit partners for everything you do to fill the gaps. I mean, without you, county services would really be pale. So I'm really glad that we're able to help you do the work you do. Thank you.
Thank you, County Executive. Now we're going to hear from Stephanie Rosen, the Executive Director with the National Alliance on Mental Illness of Montgomery County.
Thank you, ma'am. My name's Stephanie, and thank you, Councilmember Sayles, for inviting us to recognize World Mental Health Day. I'm here on behalf of the National Alliance of Mental Illness of Montgomery County, Maryland. We are the nation's largest grassroots organization dedicated to improving the lives of all affected by mental illness. We are individuals living with mental illness and their families, loved ones, and caregivers. We provide support, education, and advocacy by building communities of peers so that all can live a healthy, productive life supported by a community that cares. And as mentioned before, the theme for World Mental Health Day this year is mental health is a universal human right. This emphasizes the necessity of assuring that everyone, regardless of age, socioeconomic class, or background, should have access to high quality mental health care and support when they need it. We have so much work to do to make that a reality. Mental health treatment, which can include therapy, medication, self-care, has made recovery a reality for most people who experience a mental illness. However, the average delay between symptom onset and treatment is 11 years. We don't let 11 years go by for a lot of illnesses, but yet we do for mental health illnesses. Last year, only 47% of adults in the United States living with a mental health condition received treatment. The numbers of those who receive treatment are even worse in our communities of color. Only 25% of Asian adults, only 36% of Hispanic adults, and 39% of Black adults received any treatment for their mental health condition. What can we do to help make this a universal right? We can break systemic barriers, we can advocate, but I think if you're not in the advocacy space, if you're not an elected political official, I think one of the things that we most discount but is super important is hope. and that hope starts with all of us. Hope starts with us talking about mental health. It starts with us making information accessible, and it starts with us providing resources and practical advice. Hope starts with us sharing our own stories, and hope starts with breaking stigma. Stigma is one of the leading reasons people do not seek treatment. And stigma is the blame, shame, and guilt that our society and even ourselves place on someone living with a mental health condition. I'm here to say, well, NAMI fights for policies to ensure that people receive the best care, but like I said, we also share our own personal stories. I like to think of myself as the poster child for getting the right information, getting the right help, and receiving support that we all need to live a better life. So, thank you.
Thank you so much, Stephanie. Now we're going to hear from Alyssa Sanders, Director of Advocacy with Every Mind.
Thank you, County Councilmember Sayles, for the opportunity for Every Mind to share our thoughts on World Mental Health Day. You know, in recent years, we've witnessed significant progress in the global dialogue surrounding mental health. We've seen strides in reducing stigma, increasing access to mental health care, and even amplifying the voices of those who have bravely shared their stories, as we've heard today as well. However, our journey is far from complete. It's crucial to continue to push for a world where mental health is regarded with the same importance as physical health, where empathy and compassion are our guiding principles. As you've heard already today, the theme for this year's World Mental Health Day is mental health is a universal human right, which serves as a stark reminder that we cannot achieve true mental health equity without addressing the systemic disparities that persist in our societies. These inequalities, whether related to income, access to health care, or social support, continue to exacerbate the burden of mental health issues on vulnerable communities. To make mental health a universal human right, we must promote awareness and self-care. Knowledge is the first step towards change. Let us educate ourselves and others about mental health, dispelling the myths and misconceptions that perpetuate the stigma. That's why we at Every Mind offer important educational workshops like mental health first aid for adults, for youth, and for veterans. We must advocate for access. We must work tirelessly to improve access to mental health services for all, irrespective of income, ethnicity, gender, or location. No one should be left behind in their journey towards healing and recovery. That's why Every Mind services are at no cost to the client, and we also serve those with Medicaid, without insurance, and folks who are underinsured. We have to foster inclusivity, creating inclusive communities and workplaces where individuals can openly discuss their mental health challenges without fear of discrimination is vital. We must celebrate diversity and promote empathy. Just last week, leaders at Every Mind attended a full-day workshop on DEI and B. B. The B stands for belonging. As a workplace, we have a responsibility to foster a culture of well-being. We at Every Mind practice what we preach. In closing, and I have some quick closing remarks, but I also want to recognize that many folks are grieving right now at what's happening with world events. And so I say to all of you, Every Mind, please feel free to reach out to 988 to talk, to chat. We have supportive listening. We're there for you during what can be a very, very difficult time. Many of us are grieving. So in closing, I want to emphasize that every mind matters, every story counts, and every action we take today can make a profound difference in someone's life. Regardless of where we come from or who we are, we all share the common human experience of facing challenges that affect our mental health. Let us work hand in hand to ensure that the world we leave for future generations is one where mental health is celebrated, supported, and cherished. Thank you for this opportunity.
Thank you so much for those powerful words. Briefly, we're going to hear from the Director of Psychological Services with MCPS and read the proclamation. Thank you.
I want to thank you, Councilmember Sayles, for inviting us. My name is Dr. Christina Chester. I am the Director of Psychological Services for the Montgomery County Public Schools. And Montgomery County Schools is dedicated and committed to providing mental health services for all of our students, regardless of income levels. Our goals are to ensure that mental health and social-emotional skills, the development of these are processes where our staff, including our school-based mental health staff and our teaching staff, they work together in providing this type of support for our students. We want to make sure that we are able to continue with our budget and providing these mental health services at all tiers, universal supports for all students, plus intensive and targeted supports for those students who require more. And then we know we have seen since the pandemic the increase in need of mental health services in our schools. And so we also want to make sure that everyone here is aware, and we talk about our commitment to mental health, that MCPS is providing for all of our students. We have our annual Mental Health Awareness Week that takes place October 30th through November the 4th. With that, we are going to be having our first in-person student mental health forum that is going to take place November 1st at Richard Montgomery High School from 6 to 8 p.m. Doors open at 5:30, where we are going to have Dr. Barnett, who's a former NFL player, come and advocate. He's going to come and speak to our students around the importance of mental health and getting treatment and services when you're in need. And also, we're going to be having a community virtual mental health resource fair where we're going to be highlighting our community services like Every Mind. And that'll be taking place virtually on YouTube from 11:30 to 1 p.m. Again, that's Saturday, November the 1st. So to keep this quick, again, I want to thank you all for having me, and thank you for recognizing World Mental Health Day.
Thank you so much. I'm so glad we have partners across the street and with MCPS taking care of our community. Okay. Whereas World Mental Health Day was founded as the result of a global advocacy and awareness program started by the World Federation for Mental Health in 1992. Since then, it has turned into an occasion where thousands of individuals and groups gather to celebrate and promote the only global day for mental health awareness. And
whereas the theme for World Mental Health Day 2023 is mental health as a human right, universal human right, which focuses on the need to improve knowledge, raise awareness, and drive actions that promote and protect everyone's mental health as a universal human right. And whereas
1 in 8 people globally are living with mental health conditions which can impact their physical health, their well-being, how they connect with others, and their livelihoods. Mental health conditions are also affecting an increasing number of adolescents and young people. And
whereas of the 252,000 adults in Maryland who did not receive needed mental health care, 33.7% did not because of cost. Further, Marylanders are 10 times more likely to be forced out of network for mental health care than for other primary health care, making it more difficult to find care and less affordable due to the higher out-of-pocket costs. And finish it.
whereas vulnerable populations such as the LGBTQ+ community, our homeless population, Black, Indigenous, and people of color, victims of domestic abuse and violence, and children, youth, and adolescents all disproportionately suffer from a lack of access to mental health care. And whereas Montgomery County has been an active part of the solution by investing in school-based mental health awareness centers and the countless nonprofits who are dedicated to improving access to care, mobile crisis outreach teams, mental health clinics, the 988 suicide and crisis line. On World Mental Health Day, we must raise awareness and destigmatize mental health care issues for all who are suffering.
Now therefore be it resolved that Mark Elrich's County Executive, Laurie-Anne Sayles, as council member, and the entire County Council of Montgomery County, Maryland, hereby celebrate World Mental Health Day as an essential day to advocate for and promote equitable access to mental health care around the world, signed or presented on the 10th of October in the year 2023. Thank you.
Thank you.